Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Thanking you for checking out this Parents and Caregiver series brought to you by Blue Shield of California's Blue Sky Initiative. Hi, I'm Michael P. Coleman, Content Director for Brother Be Well. Today, in one of a series of Brother Be Well conversations in our Parents and Caregiver series, made possible by the support of Blue Shield of California's Blue Sky Initiative, we're discussing strategies and tips for talking with children about mental health. My partner for today's conversation, marriage and family therapist and Brother Be Well clinical advisor, Christian Jacobs. Christian, welcome back to Brother Be Well. How you doing?
Hi, how's it going, Michael?
Really good. Always good to see you, and always I look forward to conversations like this. So I'm ready for it. You set?
I'm excited for this one.
Let's get on into it. And I bet you're excited for one of the same reasons I'm excited. I want to set the stage. I'm a parent of two. They're both adults now, but when they were younger, I rarely, if ever, frankly, talked to them about mental health while they were growing up. I just didn't have the skill set. I didn't know how to do it. There were no videos like this one to help me do it. I would imagine you, as a marriage and family therapist, might have the counter experience, but I just want to confirm that. Have you spoken with your own daughter about mental health?
Actually, I have. The funny thing is, as a therapist, you would think that talking about mental health to my child would be easy, right? But it's almost like the concept as a barber, right? You can cut someone else's hair easily, but it may be a little difficult to like cut your own hair in that same fashion. So that's kind of the analogy I use. Looking at this, you have the skills, you have the training, as a barber to cut hair, but when you're applying it to your own self, your own life, maybe a little more difficult. So actually, many therapists do struggle with this. Actually, that concept and to provide patients with that day-to-day basis and utilize those tools in their own backyard because there are emotions attached to it, and you're being subjective. So it's a little different. And so what I've done, just found other ways to talk to her about mental health. Where she may not know exactly that we're talking about mental health, but you got to be really creative. So I really just learned to, as a parent, to stay consistent regardless, because they are indeed listening.
Yeah, they certainly are. They listen to everything we say, listen to everything we do too. Let's talk about that the specifics of talking with children. I know it's challenging. It doesn't necessarily have to be daunting as long as you do it the right way. I think just based on my experience as a parent, you know this, Christian, I'm preaching to the choir. Kids are bright, they're strong, they're resilient. And the key is to be honest, I would think, to be upfront and transparent about the topic and to give them information in an age appropriate manner. I'm wondering, sir, and feel free not to, but can you either rubber stamp that or can you get me and the rest of the Brother Rewell family straight on those points?
Oh no, you're on point there. I think honesty, being transparent, and also age appropriateness is important too. It's good. An important first step that I think should be considered before doing any of those really is understanding the concept of meeting your child where they are. That's the most challenging thing that I think we as parents forget to do. We trying to use big words or talk to them where we're at. So that's one thing. And many people hear that concept, meet them where they are, but may not really understand what that truly looks like. So I'll try and like paint a picture for you. Meeting them where they are really requires the parent to consider the child's age, the maturity, which only that parent really knows. The developmental stage, where they are developmentally, and understand that social emotional learning is not familiar to most kids. That's not a concept that's taught in schools as of yet. We're getting there. Using simple words and using simple concepts, maybe analogies, based on something that they're already familiar with, like the comparison of going to the doctor for a broken arm versus a mental health condition. They're no different, which is a weird phenomenon when you think about it. But it's true. The second thing is really of importance is understanding the importance of play therapy. Play therapy is more effective than talk therapy for children, and all the studies show that's been proven. Play therapy works similar to talk therapy for adults, except children are able to use their preferred method of expression. So play to describe their inner world. So they're playing out their emotions and what they want to say. So you want to get them engaged in doing something they enjoy before you try and talk to them about something difficult and tough, such as mental health. And the same goes for teens. As a child expresses themselves with toys, the therapist is invited to they're invited into their world and into their thoughts. So a relationship forms between the therapist and the child through that expression and that ability to cope and the rejection of their thoughts and things of that sort. So it's really helpful for them. And one other thing too is therapy sessions is really strategic. So in a therapy room, everything is strategically placed. So the chairs, the toys, the furniture, everything is strategically placed for illicit play from a child. So there's a reason for that. And so you also want to disassociate the condition from the person. So most children and adults, for that matter, they struggle. They struggle a lot with the mental health internally because of the shame associated with being depressed. I'll give you an example. There's one way of saying I'm depressed versus depression is affecting me, or depression is a part of me. So being depressed versus or psychotic versus a person who experiences depression or a person who has psychotic moments, there's a difference there. You're not associating that as you, so you're not labeling yourself. This way, when you talk to them about the issues, they can disconnect easier from that labeling concept that mental health and the healthcare system currently does now.
That's a wonderful distinction, Christian, and I hadn't thought about it before. Helping the child, as you said, disassociate from what the issue is, what they're dealing with. That's really brilliant. I appreciate you sharing it. Appreciate you sharing it. I'm wondering about, I want to talk to you about the National Alliance on Mental Illness, NAMI. They suggest a number of helpful hacks in talking to children about mental health. And it's not every day we get a marriage and family therapist of your caliber with us. So I like to take advantage of it when we do. If you don't mind, let's take a look at a few of these and see, get your take on them. The first of their suggestions is make an analogy to a medical problem. You touched on that really briefly a second ago. What are your overall thoughts about that as a way to help a child understand a concept that might be a little beyond where they're at?
That an analogy is similar to imagination and metaphors, right? And as I was saying before in the previous question, that's how you reach a child. So that's a very effective way to explain mental health to a child. And believe it or not, it's a good way to explain mental health to adults too, because it gives someone a relatable topic they can relate to in practice. I use the broken arm analogy all the time. When you break your arm, what happens? You go to the doctor. And then once you go to the doctor, what happens? They prescribe something to you. They develop a treatment plan. Okay, you're going to go to therapy after 6 to 8 weeks after your cast comes off. Once you go to therapy, physical therapy, you'll go through your treatment, and then we'll come back and we'll reassess you. And you use that analogy, where it's no different for mental health. And so you want that parity, you want that similarity between physical and mental health.
It makes a lot of sense when you explain it that way. I appreciate it, my friend. Let's take a look at another of their suggestions: listening to children and validating their experiences. That overall, that validation I found to be really important as a parent. Why is it even more important when you're talking with a child about mental illness?
Validate, validate, validate. That is something that's very important. It's a very important one. I'm going to spend a little time explaining this one. It's the most common issue I see in practice, actually. Before implementing, I'd say this that's really beneficial for parents to understand the why part of validating a child's experiences and how it improves that parent-child relationship and their ability to communicate. Validation is one of the most powerful parenting tools, actually, and yet it's often left out of traditional behavioral training programs that you may go to with your healthcare setting. Because validation really improves a child's ability to regulate emotions, and they learn how to handle the big emotions that often lead to tantrums, meltdown, and conflict. Because when you see those meltdowns and the tantrums and the conflict, they're telling you something. They're trying to communicate something to you they don't have the words for it. So it's also easy for parents to invalidate feelings, right? For example, here's a very common one, right? Trying to calm a child down. So the minute you try and calm a child down, um, subconsciously you're invalidating their feelings. Instead, you can validate and normalize their feelings by acknowledging that they're upset. So you acknowledge, yeah, I understand you're upset, and give them healthy coping tools to teaching them, better ways how to let out that anger. One that I give to patients is the pillow method. Allowing that child to go in their room and let it all out on that pillow, scream into the pillow, punch into the pillow, kick into the pillow, let them get that aggression out because that aggression is natural and it's necessary. So validation isn't always about fixing the problems for our children or trying to change their emotional experience. It's about allowing your child really to sit with their emotions and acknowledge it, and then and teach them healthy coping mechanisms to deal with their symptoms.
Really appreciate hearing that, Christian. And it's a good reminder, I'm sure, for some parents, validate, validate, validate. But for some, it might be a new concept. So appreciate you sharing that. Another of NAMI's hacks is children need to know that they are in no way at fault regarding their mental health or their own mental health or the mental health of a family member. How do parents communicate that? Because it's easy to take that blame on. It's easy for anyone, a child or otherwise, to say, this is my fault. So, how do you best, as a parent or caregiver, communicate to the child, you're not at fault here?
Well, that's very powerful because it's a very complex topic. Well, there's no perfect time or age when the conversation should occur. It's run at a certain time, but when you have the discussion, it's really important to in how you deliver it. So you have to assess the developmental age of your child. That's like one of the main concepts. You'll hear that theme several times, when I'm talking because it's very important. But when a parent has a mental health condition, have the discussion during times of increased stress. Sounds weird, right? But having those conversations during times of increased stress and struggle where the child has noticed your behavior shift. So those opportunities may open to talk and have that conversation. That may look a little weird, but actually, when you're having those times of conflict and stress, is when you can utilize those tools and skills. And also, you want to really explain to them that you have a medical condition that is mental, and there are times where mom or dad isn't feeling well. Just like a cold, right? Just like an injury. They may be tired or moody, so you're explaining to them this is transparency. Transparency is everything in this situation because children are smart. They're going to pick up. They're going to pick up when you're coping or you're using other substances to cope with something else. They're smart. So this also builds empathy in children too. So because they're the next time a parent has an episode, subconsciously the child may say, "Oh, this is this is that mental condition mom was talking about. They told me they're going to be like this, right?" Versus, "Oh my God, what's going on with my parent?" So as for a child experiencing a mental health condition, let them know it's not their fault and they didn't catch it like a cold.